Hi everyone, welcome to Imaging Study YouTube video. Today we are going to see a case of Vesico-Ureteric Junction calculus. A middle-aged male patient came to the emergency department with severe right lower abdominal pain. On ultrasound, a tiny echogenic structure is noted at right vesico-ureteric junction, causing right-sided hydronephrosis with hydroureter. Also, the right renal parenchymal echogenicity is increased. Here you can see the hyperechogenic calculus at the right vesico-ureteric junction. On the right, it's casting twinkling artifact on Doppler. Here along with the stone, you can see the part of right kidney with echogenic parenchyma and hydronephrosis. On real time, you can see the hydronephrotic echogenic kidney on longitudinal and transverse sections. Here, try to search for that calculus at the right vesico-ureteric junction. Thank you for watching this video. See you on the next one.